You've perfected your IV insertions. You're a master of wound care. You put in the years to become an expert at the bedside. But what if I told you that in the healthcare world of 2026, those skills just aren't enough anymore? The very skills that once defined an expert nurse are quickly becoming the baseline. A whole new set of skills is going to determine your relevance and your success in the very near future. In this video, we're going to break down why your nursing skills might be becoming obsolete and exactly what you need to do to stay ahead of the curve. Let's be real for a second about a feeling that's creeping into our profession. It's that sense of being devalued, of being reduced to a walking, talking checklist. You run from room to room, putting out fires, completing a list of physical tasks you could literally do in your sleep. And at the end of a 12-hour shift, buried under a mountain of charting, you have to wonder, did I make a real difference or did I just manage? Here's the hard truth. Your hard-earned procedural skills, the ones that took years to get just right, aren't becoming unimportant. They are and always will be the foundation of safe patient care. But they're no longer the thing that sets you apart. They're the price of entry. In 2026, being great at starting a difficult IV or managing a complex dressing is the bare minimum, not the mark of a future-proof professional. The very definition of a senior nurse or clinical expert is changing, and it's changing fast. It's no longer just about who has the best hands. It's about who is best with the data, the tech, and the complex human side of modern healthcare. If we don't adapt to this new reality, we risk being seen as just skilled task doers in a system that's looking to automate those very tasks. Why is this happening now? So, what's causing this massive shift? Why now? It's not one single thing, but a perfect storm of three powerful forces that are completely reshaping our work. First, we are drowning in data. The amount of patient information has just exploded. We're not just talking about vitals and lab results anymore. We're talking about continuous data from wearable devices, genomic reports, and remote monitoring tools, all flooding into incredibly detailed electronic health records. Your nursing education taught you how to take a blood pressure, but did it teach you how to spot the tiny, predictive patterns in 24/7 biometric data to stop a crisis before it starts? For most of us, the answer is a hard no. This data overload is a huge driver of burnout, as we spend nearly double the time on paperwork as we do with our patients. We're turning into data clerks instead of the clinicians we were trained to be. Second, the walls of the hospital are dissolving. The rise of telehealth and virtual care isn't just a pandemic trend. It's a permanent change in how healthcare is delivered. Chronic disease management, post-op follow-ups, mental health, and even hospital-level care are all moving into the patient's living room. This is creating brand new nursing roles that require a totally different skill set from traditional bedside care. Your ability to build rapport in person is one thing, but can you do it through a screen? Can you do a sharp neuro assessment over video or talk a family member through a complex procedure from miles away? This is the new frontier. And third, our patients are more complex and diverse than ever before. This is way beyond language barriers. It's about a huge spectrum of cultural beliefs, different levels of health literacy, and access to information that completely changes how people receive care. A one-size-fits-all patient education handout isn't just ineffective anymore. It can be downright dangerous. To give truly patient-centered care now, we need a level of cultural competence and communication skill that's light years ahead of what was expected a decade ago. We have to become true cultural navigators, able to build care plans that aren't just clinically correct, but that are also a perfect fit for the patient's culture and life. If this is hitting home for you, if you've felt this shift in your own practice, do me a favor and hit that like button. And make sure you're subscribed. We're building a community of future-focused nurses right here, and your voice needs to be part of the conversation. The solution: the 3 future-proof nursing skills for 2026. So, what's the solution? How do we go from feeling obsolete to becoming indispensable? The way forward isn't about throwing away our core skills. It's about adding to them. It comes down to mastering 3 key areas that will define the nurse of 2026. Skill number 1, the AI-augmented nurse, mastering digital and AI literacy. Let me be crystal clear. This is not about learning to code. This is about becoming a smart, ethical, and effective partner with artificial intelligence. By 2026, working with AI isn't optional, it's part of the job. Nurses are expected to be good at using it for everything from clinical decision support to analyzing patient data. What does that actually look like? Well, imagine starting your shift and instead of digging through a chart, an AI has already summarized it for you, flagging the most critical overnight events and highlighting which patients are at the highest risk for decline. This is already happening. And think about the number one complaint every nurse has: charting. AI-driven tools, sometimes called ambient scribes, can listen to your patient conversations and automatically do most of your charting, cutting down your admin work and giving you back hours for actual patient care. This tech is designed to fight burnout by handling the grunt work that drains our energy. Nursing schools are already updating their programs to include this kind of digital health tech and AI-powered sim labs. Mastering these tools makes you more efficient, safer, and a more data-driven nurse. Skill number 2, the virtual care vanguard, telehealth and remote monitoring proficiency. The second game-changing skill is becoming an expert in telehealth and virtual care. And this is so much more than a glorified video call. It's a specialty that requires real expertise in virtual patient assessment, remote monitoring technology, and top-notch digital communication. Think about a patient with heart failure living in a rural area. A telehealth nurse can manage their condition from hundreds of miles away, analyzing data from remote blood pressure cuffs and scales to catch signs of a problem days before it would have landed them in the hospital. You become the central hub of their care, coordinating with specialists and building a deep, trusting relationship, all through a screen. Job growth in telehealth nursing is set to explode, creating flexible roles that aren't tied to a hospital. But to succeed, you need specific skills. You need to know the state-by-state licensing laws, the ins and outs of HIPAA in a virtual world, and how to use tools like AI chatbots to help triage patient concerns. Nurses who master this will be leading the way toward a more accessible and efficient healthcare system. Skill number 3, the cultural navigator, advanced intercultural competence. The final skill is one that technology can help with, but never, ever replace: advanced intercultural communication. As our patient populations get more diverse, our ability to give truly patient-centered care depends entirely on this skill. And this goes way beyond just being aware of different cultures. It means actively learning how to navigate complex social and cultural needs. It's knowing to ask for a professional interpreter instead of using a family member, which can compromise privacy and accuracy. It's understanding that a patient's religious beliefs might shape their end-of-life decisions and knowing how to create a care plan that honors those values. A culturally competent nurse builds trust, which leads to better outcomes and helps reduce health disparities. It means using simple techniques like teach-back to make sure patients understand, but also creating educational materials that actually make sense for them, both visually and linguistically. In a world of diverse needs, the nurse who can bridge cultural gaps isn't just a good nurse. They are a vital advocate for equity and quality. The human touch is non-negotiable. Now, after all this talk about AI, data, and technology, I have to make one thing absolutely clear. All of these new skills have one goal: to put the asterisk humanity back into nursing. Technology is not here to replace the heart of what we do. It will never replace the empathy in your voice, the critical thinking that connects all the dots, or the comfort of a hand on a shoulder. A robot is not going to replace you. The whole point of AI literacy is to free you from the keyboard. The point of predictive analytics is to give you the heads up to step in sooner and build a real connection with your patient before they're in crisis. The point of telehealth is to meet patients where they are and tear down barriers to care. These are just tools. They enhance our clinical judgment. They don't replace it. They handle the repetitive, boring tasks so that we can focus on the complex, compassionate, human work that only a nurse can do. The future isn't about being replaced by tech. It's about being the skilled, empathetic pro who knows how to use it. So, are your nursing skills truly obsolete? No. But on their own, they are quickly becoming incomplete asterisk. The future of healthcare demands more from us. It demands that we be more than masters of procedure. It demands that we become data interpreters, virtual care providers, and cultural navigators. These forces of change, the data tsunami, the dissolving hospital walls, and growing patient diversity, aren't threats. They are invitations. They are our chance to elevate our practice, to reclaim our time for our patients, and to cement our role as the indispensable heart of healthcare. The future of nursing isn't about being replaced by robots. It's about becoming the skilled, empathetic human who knows how to lead them. The choice to evolve is yours. What emerging skills are you focusing on in your own practice? Which of these 3 areas are you most excited or worried about? Share your thoughts down in the comments below. Let's start a real conversation about our future.